There is a combination of problems that lead to sinus infections. Viral infections can lead to a sinusitis, bacterial infections, fungal exposures and sensitivities can lead to it. Allergies can lead to sinus infections. It's really a process of inflammation of the mucosal lining. You tend to then get blocking of the natural openings to the paranasal sinuses. Then you end up getting negative pressure in the sinuses, fluid accumulation, oftentimes bacterial growth in these fields, leading to the multiple symptoms that people complain of.
The most common symptoms of sinusitis are facial pain and pressure, nasal congestion, nasal discharge, especially yellowish or greenish discharge. Tooth pain can be an indication, headache, also sometimes fever.
If a person starts out with an upper respiratory tract infection and the symptoms, say the nasal congestion, the drainage, the pressure, if these symptoms start improving within the first 7 to 10 days and goes away by that time, then there's a good chance that was a viral infection. But if you have an individual who starts improving for the first few days and then worsens, or if the problem persists beyond 10 days, then you start thinking about the bacterial infections.
Balloon sinuplasty is basically a surgical procedure where you thread these catheters through the natural sinus pathways to enlarge them to allow them free drainage, and thus limiting the effects of sinusitis.
If the procedure is limited to the balloon sinuplasty, typically they can bounce back to their activities fairly quickly. At times we will need to do the balloon sinuplasty in addition to some slightly more invasive procedures that then would require the patient to be off work for at least a week, but that's not always the case. But typically, if we strictly stick to enlarging the openings of the sinuses with the balloon, less than a week's time, and really in a few days, they can get back to their routine.